Good morning, everyone. Today we'll discuss about 2015 Millennium Development Goals. The United Nations Millennium Development Goals are 8 targets that all 191 United Nations member states have agreed by 2015. The creation of the Millennium Development Goals was a pledge to uphold the principles of human dignity, equality, and equity, and to free the world from extreme poverty, signed by the United Nations Millennium Declaration in September 2000. All these goals cannot be attained without addressing each and every one. All of them influence, affect, and depend on better global health programs and policies. Here are the 8 Millennium Development Goals. First, eradicate extreme poverty and hunger. Developing countries, particularly in Africa and Asia, suffer from extreme poverty and hunger. Poverty and hunger lead to severe malnutrition, which leads to lifelong physical and cognitive damage and affects health, well-being, and economy. Some key suggestions to eradicate poverty and hunger are education, promoting gender equality, producing more jobs, investing more in agriculture, strengthening nutrition programs for children and infants, support and protection of vulnerable countries during crisis. Only 2 short decades ago, nearly half of the developing world lived in extreme. The number of people now living in extreme poverty has declined by more than half, falling from 1.10 billion in 1990 to 836 million in 2015. Goal number 2. Achieve universal primary education. Persons, particularly women, are more educated, are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting health sanitary practices, and ensuring immunization of children. As an effect, infant and children have better survival rate, are healthier and nourished. If these are attained, children who receive primary education are more likely to marry and have their own families at later stage life, practice family planning and have fewer children, know rights, responsibility and civic obligations, seek employment and sustain personal and family needs, and have decreased risk of getting sexually transmitted diseases like HIV and AIDS. Between 2000 and 2012, the total number of out-of-school children worldwide declined from 100 million to 58 million, and the global primary completion rate increased from 81% to 92%. More girls are now in school, and women have gained ground in parliamentary representation in nearly 90% of the 174 countries with data over the past 20 years. Goal number 3. Promote gender equality and power movement. Gender equality means equal representation of men and women. It implies that all genders should have equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work, finances, and other aspects, which improves the economy and lessen effect of financial crisis. Gender equality can be achieved through early childhood development intervention, promotions of women's political rights and involvement, improve reproductive health programs and policies, education, and integrating gender equality in school curriculum, improve women's access to work and strengthen labor policies for women, support and protection of developing and vulnerable countries during crisis. The world has also witnessed the dramatic improvement in gender equality in schooling since the Millennium Development Goals. Reduce child mortality. Programs and policies which help reduce child mortality, like improving nutritional intake, healthcare facilities, infrastructures, and other fields which improve children's lives, strengthening local and national health programs and policies is one way to reduce child mortality. This includes immunization programs, assuring survival and better health of the mothers, improving reproductive health and policies and programs, better nutrition programs for children, infants, and mothers. The rate of children dying before their fifth birthday has declined by more than half, dropping from 90 to 43 deaths per 1,000 live births since 1980. Goal number 5. Improve maternal health. Improved maternal health is not only about mother's health but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender inequality, decreased workforce, lower birth deaths, and disability of women. Some ways to improve maternal health includes improve and proper nutrition of mothers, teaching the benefits of birth spacing and small family size, educating young girls and boys about the importance of maternal health, better and improved access to hospital care, especially obstetric, gynecology, prenatal and postnatal care. Maternal deaths dropped 45% between 1990 and 2013. Every day, nearly 800 women across the world die due to complications during pregnancy and childbirth, as 99% of those deaths occur in developing countries. Figures for maternal mortality show a decline of 45% worldwide, with the most of the reduction occurring since 2000. Goal number 6. Combat HIV or AIDS, malaria, and other diseases. Emerging and re-emerging diseases like HIV or AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the diseases outbreaks are loss of jobs, shortage of professional workers, and creating social crises. Children are the most vulnerable, are more exposed to exploitation and abuse, undermining their normal growth and developing. Some easy to combat diseases include effective prevention, treatment, and care, like improved housing conditions, increased access to anti-malaria medicine, promoting safer sex behavior and preventive education for all, promoting tuberculosis screening of HIV or AIDS persons, TB directly observed treatment short of TB dots, course therapy, promoting the use of insecticide-treated nets to fight mosquito-borne diseases. Targeted investments in fighting diseases such as HIV or AIDS and malaria have brought unprecedented results. New HIV infections fell by approximately 40% between 2000 and 2013. Over 6.2 million malaria deaths have been averted between 2000 and 2015. Tuberculosis prevention and treatment interventions saved an estimated 37 million lives between 2000 and 2013. Goal number 7. Ensure environmental sustainability. Investing and supporting sustainable energy like solar, wind, and water energy help support jobs, create business opportunities, and save non-renewable energy sources. Environmental and sustainability assures people to live healthier and enjoy clean and green environment. Some of the benefits of sustainable environment are cleaner air environment, clean environment, friendly and renewable energy, new and aspiring jobs and business in energy, increase access to sanitation. Worldwide, 2.1 billion have gained access to improved sanitation, and the proportion of people practicing open defecation has fallen almost by half since 1990. Official development assistance from developed countries show an increase of 66% in real terms from 2000 to 2014, reaching $135.2 billion. Goal number 8. A global partnership for development. The World Health Organization, World Banks, and governments work together to make sure there's fair trade and that heavily indebted countries to obtain reliefs and fund to combat poverty, malnutrition, and funds for education and social projects. Some benefits of global partnership are expanded international agreements, improve access to affordable medicine, reduce poverty through government debt and relief grant, develop information and communication technology infrastructures. World leaders have called for an ambitious long-term sustainability agenda to succeed the Millennium Development Goals. Thank you and have a good day.